Good afternoon. I would like to thank each and every one of you for being here with us at this live session from MAHSA University, Sarjana Putra campus. I am Tawa Selvi, lecturer from Faculty of Health Sciences, Nursing and Education, MAHSA University, and I will be moderating today's session. Today's webinar, Tinnitus and Vertigo, a Nursing Perspective, is proudly organized by the Faculty of Health Sciences, Nursing and Education, MAHSA University. Dear viewers, before we proceed further, I would like to give you a brief overview of the programs offered by the Faculty of Health Sciences, Nursing and Education at MAHSA University. At MAHSA, we, under the Faculty of Health Sciences, Nursing Education, we offer at School of Education, School of Physiotherapy, Department of Environmental Health, Department of Medical Imaging, and also School of Nursing. Under the School of Physiotherapy, we offer Diploma in Physiotherapy, Bachelor of Physiotherapy full-time, Bachelor of Physiotherapy open and distance learning, Master of Physiotherapy, and Bachelor of Sports Science. And under the Department of Environmental Health, we offer Diploma in Environmental Health, Bachelor of Environmental Health and Safety, and also open distance learning, and Diploma in Occupational Safety and Health. Under the Department of Medical Imaging, we offer Diploma in Medical Imaging, Radiography, Bachelor of Medical Imaging, full-time, and also Bachelor of Medical Imaging, open distance learning. And under our School of Nursing, we offer Doctor of Philosophy in Nursing, Master of Nursing, Bachelor of Science, Nursing, Bachelor of Nursing Sciences, open distance learning, and also Bachelor of Nursing Science, Public Health, Advanced Diploma in Midwifery, Advanced Diploma in Pediatric Nursing, and as well Post-Basic Certificate in Renal Nursing, Critical Care Nursing, Peri-Operative Nursing, and also Gerontology Nursing. Under the School of Education, we offer Diploma in Early Childhood Education, Diploma in Education, and as well English for academic purpose. And why join health sciences? It's due to our high job demand, which is essential services, no boring work routine, lucrative remuneration, low risk of job redundancy, cannot be automated, opportunity to work in variety of settings, and a career that you can feel good about. Now we are talking about the entry requirement for Master of Physiotherapy, 1-year program, which is a full-time, a 2-year program for a part-time. And these are the entry level requirement, which is a bachelor's degree and also English proficiency for international students. And for all the degree of bachelor's for physiotherapy, environmental health safety, and also medical imaging, these are the entry requirement, which requires a matriculation or pre-university or STFAM level, A level, or diploma. For diploma in physiotherapy, diploma in environmental health, diploma in medical imaging, these are the entry requirement, which needs a SPM, either TCE or O level, and a certificate. For diploma in occupational safety and health, we offer 3-year program, which requires SPM or O level or certificate level. At MAHSA University, an infinite excellence is what MAHSA aspires to provide to each of its graduates. So why choose Faculty of Health Sciences, Nursing and Education at MAHSA? because its experienced and dedicated international pool of academic staff, various study modes, either conventional or open distance learning, cross-teaching experts. MAHSA has the most number of health disciplines in a single institution among IPTS, interactive teaching and emphasis on hands-on clinical skills, face-to-face or online platform, wide list of hospitals, institutions for clinical and industrial placement, accredited by MQA and JPA with international recognition, 12 award with ARU. We also offer scholarships, which is our Haji Abdullah Academic Excellence Scholarship, Foundation Scholarship, Blue Ribbon Scholarship, School Teachers Scholarship, Family Scholarship, and also the Single Parent Scholarship. We also have collaboration and affiliation. To name a few, we have collaborated with Chiang Mai University, Thailand, Sri Vijaya University, Indonesia, Lovely Professional University from India, and also Iryo Sosei University from Japan. And this is our student mobility program from Iryo Sosei University. Student mobility program from Lovely Professional University, India. And also student mobility program from Sri Vijaya University, Indonesia. So we welcome you to join us. And you can contact us via various platforms of our social media. So please contact us through MAHSA website or through our faculty Facebook page to know more about our programs, or simply leave a comment. We will get back to you. Our question concerning this webinar session can be listed in the chat box. So, introduction to our webinar. This webinar will provide an overview of tinnitus and vertigo, highlighting their impact on patients and the importance of early diagnosis. It will delve into the nursing care aspects, including assessment techniques, symptom management, patient education, and up-to-date treatment options. Now, let me introduce you the speaker of today's webinar, our Ms. Liao Leikin. Ms. Leikin holds a Master of Nursing and a post-basic certification in gerontology nursing. She has published various journal articles and has guided postgraduate students in the nursing department. So, Ms. Liao, the screen is all yours.
Hello, everybody. Thanks, Sylvie. Okay, good afternoon to all the participants in today's webinar. Today's topic is on tinnitus and vertigo, a nursing perspective. I'm Leikin from School of Nursing. So in today's webinar, we are looking at, of course, we only have three outcomes for today's short session. We're going to have an overview of tinnitus and vertigo. And then after that, we are going to have a discussion on the impact of the conditions and the importance of early diagnosis. And after that, we are going to discuss on the nursing care for the patients with tinnitus and vertigo. Is that okay? Right, let's see the ear anatomy. So of course, you know that ear we have three parts. We have outer ear, middle ear, and inner ear. And we're looking at the two conditions like tinnitus and vertigo and actually affecting the inner ear. Okay, so of course for tinnitus, when you look at tinnitus, a buzzing sound, of course the function is the problem with the cochlea. And then of course with vertigo, and of course is related to semicircular canal. Okay, of course, before we start the session, we are looking at a simple Just a review on the sound transmissions.
The ear has three parts: the outer ear or auricle, the middle ear, and the inner ear. The auricle, the visible part of the ear, collects sound waves and directs them to the auditory canal. The auditory or ear canal is lined with cilia and ceruminous glands. The earwax from the ceruminous gland and the cilia protect the ear from entry by foreign matter. The thin tympanic membrane separates the outer ear from the middle ear. Sound waves cause it to vibrate. The three tiny bones of the middle ear are the hammer or malleus, anvil or incus, and stapes or stirrup. These bones pick up the vibrations from the tympanic membrane and transmit them to the inner ear. The eustachian tube of the middle ear opens into the pharynx and permits air pressure to equalize between the ear and the outside air. The inner ear is maze-like, consisting of bony and membranous structures surrounded by fluid. The semicircular canals are fluid-filled bony loops that help maintain our body's balance. The cochlea is a fluid-filled, snail-shaped structure that houses the organ of Corti, the true organ of hearing. The fluid aids in the transmission of the vibrations. The organ of Corti changes the vibrations into nerve impulses that are picked up by the auditory nerve. Sound waves are collected by the auricle or outer ear and sent to the auditory canal, tympanic membrane, ear bones, and then to the cochlea, where the vibrations are changed by the organ of Corti to nerve impulses and transmitted by the auditory or cochlear nerve to the temporal lobe of the brain for interpretation.
Okay, looking at the functions of the ears, of course, they have two main functions. The first one is hearing, and then, of course, the second one is balancing. And let's have the first overview on the tinnitus. Tinnitus is, like, of course, is a perception of sound in the ears. There's with no external sound in present, but is often described as ringing sound, buzzing sound, or hissing sound, or even clicking sound. Okay, and but also can be perceived as other noises as well. This is the definition 2023 by National Institute of Deafness and Communication Disorder. Okay, look at tinnitus, the signs and symptoms that we mentioned earlier. And when you look at that kind of sound, tinnitus sound, they'll be there constantly, sometimes intermittent. The sound can be very disturbing. Like, for example, sound like buzzing sound of the insect. Sorry. Sorry. There's are you still with me? Hang on.
Me, looks like we have some few technical difficulties. Meanwhile, I'll show you all our online virtual tour. Just hold on.
at Bandar Saujana Putra. I will be highlighting the different types of facilities and services that we offer to our students. Okay, guys, here we are.
Okay, so we are back to Miss Liao.
Yes, I'm back. Can you see me?
Yes, yes.
All right, let's continue. I'm trying to show you the tinnitus sound, but somehow the internet was like disconnected. Hopefully it's okay now.
Can you hear it whistling?
So this is the tinnitus sound for those who have suffered from this problem. Like sound like running engine, metal grinding against metal, wind or fan hissing sound from a kettle or a frozen light. When we turn on the light, there's no clicking sound. Okay. Of course, we're looking at what are the causes of tinnitus. First, mainly because it is due to age-related hearing loss, and of course, certain type of ear injury after sometimes accidents, and as well autotoxic medications such as aspirin and furosemide, aminoglycosides group of medication, and some other medical condition like diabetic mellitus, prolonged exposure to loud noises, like those who are using the earphone at a loud, loud high level, and of course, inner and middle ear infection and infected earwax. The third one, there's two types of tinnitus. We have mainly 99% of the tinnitus belongs to subjective tinnitus, where there's noises in the ears that only can perceptible by the patient, 99% of it. And of course, this 1% is objective tinnitus. Objective tinnitus is noises in the ear that can audible to the patient and other people near to them, like family member, the healthcare profession, if they want, they can use stethoscope to auscultate. Right? Just place a stethoscope behind the ear, they can hear the sound. Okay, so there's an overview for tinnitus earlier. Let's have a look in this picture. We're looking at vertigo. Okay, so of course, it's the thing that's spinning around, and definitely it's a sensation of spinning or dizziness, often accompanied by nausea, vomiting, and problem in balancing. Okay, so of course it can be caused by various conditions, including inner ear disorder, neurological problems, and due to certain medications. The same group of medication cause tinnitus, autotoxic medication. Okay, so these are the causes like inner ear disorder, for example, PPV, benign paroxysmal positional vertigo, Meniere disease, different types of neurological conditions like stroke, autotoxic medication, as you mentioned earlier. Yeah, of course, we know that Malaysia, we have a lot of people suffer from hypertension, and the two group of drug like furosemide and aspirin is commonly prescribed to this type of patient. So of course, when they get older, sometimes they have tinnitus, they have vertigo, they think that they are getting older, but maybe this is due to the medication that they are not aware of. And these are the symptoms. Patient will have not just spinning around them, they will come with the symptoms like severe nausea and vomiting. They have issue with balancing. They are not able to walk in a steady gait, and of course, you will have involuntary eye movement as well. These are the impact of the condition, the two conditions we're looking at, tinnitus and vertigo. So of course, they definitely will impact a person's quality of life. When there's one issue like tinnitus or sometimes just vertigo, but if these two conditions come together, it will, of course, it will cause more greater challenges to the patient. Okay, the impact of tinnitus. Of course, buzzing sound constantly that disturbing. They can cause emotional distress, anxiety. Sometimes it's all the while it's there. The sound, and they can cause depression as well, frustration, and feeling of isolation. Sleep disturbances. Yeah, this kind of sound can make it difficult for the patient to fall asleep or stay asleep. They have a very poor quality sleeping habit, leading to fatigue and irritability when they wake up the next morning. And of course, the third one is the impact is impaired concentration. When these kind of conditions can interfere with their concentration and focus, of course, the person with this condition will not be able to work, focus well in their activities. And of course, eventually it can cause social withdrawal. And of course, this kind of sound, constant sound can be embarrassing and distressing to the person, leading some individual to withdraw from social interaction. Okay, so this is the impact for tinnitus. When I look at vertigo means spinnings around them, and patients will have feeling of instability. So they have feeling. It's not like they are having the problem, but they are leading to fears of falling. And with that, they have limited their activities, especially elderly. They do not want to walk and reduce their mobility. And the issue with nausea and vomiting, it can cause, patients don't refuse to eat and drink because this vertigo induce nausea and vomiting. And social limitations, same like earlier, they have reluctance in participate in social activity, or even they don't like to travel. Then the last one is impaired balancing and coordination. So vertigo can affect the balance and coordination, increase the risk of injury and accidents. Okay, so it's the impact of vertigo. When it comes to combinations of both tinnitus and vertigo, you can see the impact. It become more severe. It will increase anxiety and depression, and of course, difficulty in coping with their daily life, and then the activity become more challenging. Definitely, it will reduce the quality of life. That's the reason we need to take as a nurse, we have to empower the patient so that they can get early treatment, early diagnosis. Like for example, with that early diagnosis, we can prevent further complications of the condition. And of course, improve early diagnosis can improve treatment outcome, so that the treatment can be more effective and can relieve symptoms. With that as well, we can enhance quality of life for the patients. You okay? So we have done two conditions with the impact. So now you're looking at our nursing care for the patients with tinnitus. So we separate like tinnitus, what do we do with them, and vertigo. So it's two different care that we can provide. Okay, so for nursing care for patient with tinnitus, the buzzing sound in the ears, yes, we can focus on assessment, education, coping strategies, and medication. Okay, so assessment, we can, comprehensive history taking and psychological assessment and hearing assessment, participate in a hearing assessment for the patient, or sometimes early referral. And number two, we're looking at education, effective health education towards our patients on the information on tinnitus, the impact, and if require, this patient on hearing aid, we are showing, empower them so that they're able to use a hearing aid effectively. The third one is coping strategy like CBT and sound therapy, medications that we're going to discuss later. So right, just now is the first one on assessment, comprehensive history taking, psychology assessment, and of course, when we assess the patients, we assess the emotional level, anxiety level, and coping mechanism. Hearing assessment, of course, their hearing status, and that contributing to tinnitus. Health educations on the tinnitus information, give that we provide them with simple information so that they're able to know the causes and they're able to manage the conditions effectively. Hearing aid information, if required, of course, hearing loss can contribute to tinnitus. They need to know how to take care of their hearing aids and how to get, sometimes they get a proper I mean, sometimes the hearing aids, the battery, they know how to manage the hearing aid effectively. Number 3, we're looking at coping strategy. Coping strategies is now we are looking at CBT and sound therapy. So CBT is a cognitive behavior therapy to help patients to cope with tinnitus. Like for example, we help them like challenging negative thought. We assist the patient in know their problem and the challenges that identify their negative thought related to tinnitus, and develop a skill set, a full set on how to cope with the tinnitus. So of course, diversional therapies such as mindfulness and relaxation technique. Number 2, we're looking at sound therapy, which is considered quite effective in managing tinnitus. So like you can use white sound or natural sound, encourage patients to use external sound to mask the sound of tinnitus. They can use WNG, white sound, white noise generator. When they have this white noise, something like this. Can't hear, no sound here. Okay. There's a white sound that is supposed to be here. And as well, we can hearing aids with the tinnitus masker. Nowadays, tinnitus, they manage with hearing aid. Even now, the latest one, they have AI generated, integrated hearing aid. Okay, medications address underlying condition. So what causes tinnitus? Like infections, impacted earwax. So we treat the underlying conditions effectively. And of course, manage the symptomatic management of the condition. Okay, so tinnitus. Next one, you go to nursing care for patients with vertigo. Same, we're looking at four important nursing care. The first one, assessment, education, VRT, vestibular rehabilitation therapy, and medication. So assessment, same, like looking at history, balancing assessment and neurological assessment. For education, we're focusing on vertigo information, coping strategy, and home safety. So of course, looking at home safety, if the patients are having vertigo and they're driving, for example, or sometimes this is about ADL at home, they have vertigo and sometimes they have fall, maybe. So of course, and patient end up with fracture, there'll be a big issue with the elderly person. The next one on VBT, we're looking at balancing exercise and cannulate repositioning maneuver. And the fourth one on medication, address underlying condition and manage the symptom effectively. Okay, the first one on assessment, of course, comprehensive history taking, like we gathered the thorough, detailed history about the onset of vertigo, what are the trigger factor, the duration, and what are the characteristics of vertigo. And of course, what are the symptoms? Sometimes vertigo, just spinning around them without nauseous and vomiting. For some cases, they have come with the nauseous, vomiting, and even certain level of hearing loss. And when we look at the balancing assessment, we evaluate the patient's balancing and the coordination using appropriate tests. And the neurological examinations, of course, we use assess the neurological status to rule out other potential causes that lead to the vertigo. Of course, nursing, we look at our role and function. One of the important role is educator. So of course, nursing education, patient education, effective health education is very crucial in managing so that the patients were able to manage their symptom, the disease condition. So of course, informations on vertigo information, we provide them with, what are the causes, what causes this problem, and how to manage the problem, the issue with vertigo, and the coping strategy like diversional therapy, relaxation, stress management, and CBT that help patient to cope with vertigo. Home safety, of course, to reduce risk of fall is a main focus. Okay, we do not want patient to fall because of vertigo. And lifestyle modifications that, of course, the patient need to know what are the trigger factors that cause vertigo and make the necessary adjustment to their ADR or activity of daily life. The third one, we are looking at VRT, vestibular rehabilitation therapy. We have two here, balancing exercise and cannulate repositional maneuver. Look at the first one, balancing exercise. We teach a patient specific exercise to improve balancing and coordination. Of course, usually we in this kind of exercise, we always have a very good teams like with the physiotherapy therapies to assist in this kind of exercise. Okay, the level 1 exercise which can help to improve the balancing for vertigo condition, like for example, rhomboid exercise, standing straight exercise, and marching in place exercise. And the level 2 exercise not just help to improve the balancing for vertigo, it also can reduce the symptoms, like for example, turning in place and head movement while standing. So of course, while doing these two exercise, the safety is very important. We need to ensure that there's someone, with the patient when they have in higher level of vertigo. And the second exercise in the cannulate repositioning maneuver. It's very effective, proven to be very effective for patients with BPPV, benign paroxysmal positional vertigo. And also we can teach them aptly maneuver to reposition displays of ear crystals. So this is exercise that they can do at home. The patient is lying down, of course, when they have a vertigo attack, they do this exercise and it's proven to reduce the symptoms. And for medication, of course, we treat the underlying condition. What causes vertigo? Of course, what underlying condition effectively, and manage the symptoms like nausea and vomiting, we use antiemetic and sometimes a tranquilizer as well. Yeah, this is coming to this conclusion. We're looking at overview of tinnitus and vertigo. And of course, we discuss impact of the conditions and importance of early diagnosis. And of course, we discuss on nursing care, our role and function as a nurse in related to patients with tinnitus and vertigo condition. Because encouragement, empowerment is very important for our patient to reassure them that tinnitus and vertigo can be managed effectively with appropriate care. Again, of course, in Malaysia, we have a support group like Tinnitus Malaysia. They have Facebook, they have support group, and in additional resources for the patient. Because in Malaysia, we still do not have a SOP for the hospital in how to manage the condition. Around like 20% of the population for those who are above 55 years old have this tinnitus condition. And the latest 2019 research in one of the JPA, in one of the hospital in East Coast, they are confirmed that they refer to audiologists, sometimes ORL specialists. They have different way in managing the condition. When it comes to the condition become chronic, and they do we call that there's one therapy, tinnitus rehab therapy in Malaysia. So of course, hopefully we do not have to, those who have tinnitus issue or vertigo do not have to suffer longer. If we have more effective like nursing care, early diagnosis, self-awareness, so that they are able to aware of their conditions, so that they can prevent further impact to this problem. Okay, I guess there's any questions. We come to Q&A session.
Okay, thank you, Ms. Liao, for the insightful presentation. Dear viewers, if you have any question for Ms. Liao, please leave a comment. Ms. Liao, we so far have two questions. First question is by Abida. The question is, nurses are in daily contact with the public and there is a lot of noise. So how to improve it with things like tinnitus and vertigo? No problem, no pressure. Is this possible?
Sorry, Sylvie, may I have the question again? I didn't see in the chat. Can you please put the question in the chat, please? By Hamida, is it?
Yeah.
Okay,
it is
nurses,
Hamida.
Abida, okay. Nurses are in daily contact with public and there's a lot of noises. Nurses are in daily contact with public and then a lot of noises. So how to improve with things like tinnitus and vertigo? No problem, is that possible? No problem, no pressure. Abida, can I have a more details like of your question? You're looking at the nurse, you're dealing with public, and you have exposure to sound, and then do you have the issue with tinnitus or vertigo? Sylvie, do you get like the questions really? In daily contact, I mean how to reduce exposure, is it? Abida, you want to know how to reduce exposure so that you are not going to suffer from tinnitus and vertigo, or what? What do you want to find out more in these questions?
Perhaps probably in the hospital setting, the question?
Yeah, if they're looking at it in public, nurses are daily contact with public. Is that the public health nurse? There's a lot of noises, so how to improve with things with tinnitus and vertigo? Okay, assuming the nurse with the conditions with vertigo and tinnitus, they can use the latest. Of course, the most effective way would be their hearing aids. Hearing aid not just for hearing loss. Now it's proven to be very effective for patients with tinnitus as well. Okay, they have the white sounds. They can mask the exposure to the public sounds. So it's very noisy. For example, they can mask the sound so that this kind of tinnitus will not disturb them, so that they're able to increase their focus in their task. Hopefully, I answered to Abida questions.
Okay. Next question is, why is people saying there is no cure for tinnitus?
Okay. There is no cure for tinnitus. Same like diabetics, we manage the symptom, we manage the condition. So no cure for that because of the injury to the, like semicircular canal, or of course, we're looking at nerve as well and cochlea. So when the injury happens, is irreversible. So of course, we have to live with that, unfortunately. Unfortunately, have to live with that. And of course, how do you manage it so that these conditions will not disturb us, so that we can improve our quality of life, even though with tinnitus, so that it's the tinnitus we can manage in a early diagnosis, so that it will not become more severe. Sometimes sound, I was trying actually to play with the sound, somehow it's not there, Sylvie. The sound of tinnitus, it's really puzzling. It's really disturbing. If let's say meter is still okay, like maybe nighttime, but it's buzzing sound all the while. Wow, I can't imagine myself with this kind of sound all the time.
Yeah.
And the phone as well, sometimes can also increase some of the injury. But anyway, yeah, this is how they have to live with tinnitus and and live harmonious with the tinnitus as well.
Yes, that's right. So looks like we don't have any more questions. So the viewers, please fill in the survey form, which can be found at the comment section by the end of this webinar. E-cert will be awarded. And looks like we have come to the end of today's session. Thank you, Ms. Liao, for joining us today and
Thank you,
providing
Sylvie.
such an insight.
Thank you to all the participants. Thank you. Bye.
And
Bye.
and then to our wonderful audience, thank you for joining us at this webinar. And we look forward to your comments and participation at future events hosted by the MAHSA University. Please fill in the survey form, which can be found at the comment section by the end of this webinar. E-cert will be awarded, and in case of any further queries, you can contact us through MAHSA website or visit our social media. So have a pleasant day all.
Okay, bye.
Thank you. Bye.
Thanks.